Hi everybody, welcome to the BRCA Boss. I am Dr. Jamie Pribyl, and today I wanted to go over some strengthening exercises before surgery. So once again, I wanted to just talk about I'm going to be having a prophylactic bilateral mastectomy with DIEP FLAP reconstruction, which means they're going to be taking tissue from my stomach to recreate the breasts. So a lot of times after the surgery, people are pretty immobile and they have a really hard time getting up from sit to stand. So we really want our legs to be strong. Okay, so I just wanted to go over some really basic exercises. These are all exercises that I'm sure everyone knows how to do or they think that they do. I just want to go over some proper form and just some gross exercises that I think are really functional that you can target multiple muscles at once to get the biggest bang for your buck. So the first one is pretty simple, squats, okay? So depending on where you are in your journey, some of you I understand are just had chemo, radiation, some of you have had cancer, some of you have not. If you're like me, I do not have cancer, and I am very fortunate that I have not been through that debilitating journey at this time. So I'm pretty strong and pretty functional. But I just want to show you some proper exercises, so in proper form of the squat. So you want to put your feet hip width apart, and you're going to sit back like you're sitting in a chair, okay? So the biggest key about squats is that you don't want your knees to go in. So if you're really weak through your hips, when you go, people will kind of bring their knees in and their knees will go forward over their toes. So you want your knees facing straight out and your butt back, okay? From this side, you don't want your knees going over your toes. So sit back, kind of like you're sitting on the toilet or sitting on a chair. And then when you come up, you want to come up and get a nice little glute squeeze. That's really going to strengthen those glutes there. If that's not enough for you, I mean, I would say with all of these, basic, it's going to be 3 sets of 10. You want a nice little break in between so that you don't fatigue out. If the air squats are not enough, you can add weights. So as you can see, I didn't lean over with my back, I squatted with my legs. But you can hold them right here to the side, belly button to spine, that becomes a core exercise. I'm going to go over that one in a little bit to make sure that you engage that core with everything that you do. But you're going to sit your butt back and come on up and get a little glute squeeze at the end. Okay? Now another one for legs, while I keep these here, are lunges. You can come forward, come down, barely touch, and come back up. Once again, I never want my knee going over my toe. What I mean by that is if I'm leaning or my knee is over my toe, that's not good mechanics. Okay, so you want to come forward, you want to really reach forward so that your foot is so far forward that when you squat down, your knee is about a 90-degree angle. Okay, so about 3 sets of 10. Find a good amount of weight. Right now these are 2 10-pound weights. I'd be pretty fatigued at the end of 3 sets of 10 with that. So I'm going to come back over here and put these down with a squat. Next one is step ups. Okay, this is a pretty small step, but you can come up and down. Same thing, you just want to make sure that this knee is never going over the toes, so you don't want to be lunging over. And when you come down, you don't want to be bringing that knee over the toe, you want to come back. Put some weights in your hand, and that's really going to get basically the quads, the glutes, and a little bit of the hamstrings. Okay, so I want to go over some good core exercises with you guys, and I really just want to focus on engaging the transverse abdominis. Basically, we all know sit-ups and we know different ways of strengthening our core, but I think that people really miss the key to core, which is the transverse abdominis. And that's a very different muscle than the rectus abdominis. So the transverse abdominis attaches to our spine, it wraps around our stomach, and it attaches to the other side. And the way that we contract that is by sucking our belly button towards our spine. It's kind of like putting on a tight pair of pants. So when you're doing core exercises, you never want your stomach to bulge out, because sometimes we kind of increase that intra-abdominal pressure and we pooch our stomach out, and that's not how you want to do it. You want to be sucking the belly button towards the spine, so it actually acts like a corset and tightens and protects your spine. So I'm going to show you a good way to do that right now. So this is just kind of beginning, starting stage. Okay, so you're going to lie here with your back flat on the ground in a hook lying position with your knees bent. You don't want your feet exactly touching your butt, you just want them a little bit further away so you're really comfortable. Okay. The first one to do is just trying to find that engagement, okay? So you can use a pelvic tilt to find a position of comfort for your spine. You don't want your back arched all the way, and you don't want to use the pelvic tilt to do this. Sometimes people push their back into the mat and almost lift their hips, and they think that's the contraction. Now when you do a bridge, you want to engage the transverse abdominis, but that's not how you get it. So I'm going to find a position of comfort. So my back is flat here, and now I'm just going to lightly suck my belly button towards my spine while maintaining normal breathing. Now if you're weaker in this area and you're not sure if you're actually getting that contraction, to know you should be able to feel it right underneath your hands, but it's still kind of hard to tell. So if you do pursed lip breathing, if you use your breath, if you inhale and when you exhale like you're blowing through a straw, you're gonna feel that muscle engage. It's that tightness right there, okay? So if you're brand new at this and you have a hard time contracting, just use your breath. When you breathe in, press your belly out, and when you exhale, press that belly button down towards your spine, okay? Now that could be just one exercise, and just do that for a couple minutes. If you feel like you have that contraction, then you can do a little oblique contraction. So keep your back flat, suck your belly button towards your spine, lean forward and with this knee to the opposite hand and contract. And just push your knee against your hand and then come back down. And you're going to switch and do it to the other side. Each one of these you can do about 5 seconds and do it about 10 times on each side. If you're pretty good with that, a progression from there, suck your belly button towards your spine and slowly walk out. Now as soon as I walk out, walk my feet away from my spine, as soon as I start to feel my back arch, I'm going to stop and I'm going to come back. Because I want my back flat and my belly button towards my spine. Okay? And I always recommend people to relax and reset in between to make sure that that muscle is still engaged. A lot of times the muscle fatigues. If you don't check in to see if the muscle's engaged during the process, you could be walking out and walking in and that muscle has shut off and you don't even know it. So then you're just moving your legs and that's not a true exercise, okay? So check in, relax, reset, and palpate and make sure that that muscle has been contracted. Keep that belly button towards your spine. So these are some very basic core exercises if you haven't been exercising or if you don't feel like you've been contracting the transverse abdominis correctly. There are some very advanced core exercises that I can show at a later date. But you need to make sure you have that transverse abdominis contraction before you even start thinking about using the rectus abdominis, which is going to be more of that sitting and Pilates type movement that a lot of people like to do. You kind of combine those together. So make sure you don't do too aggressive exercises too early because the last thing you want to do is hurt your back before you go into the surgery. So thank you for watching my channel. If you do like the content, please subscribe down below, and there is a bell down to the right and it can alert you whenever I post. I'll probably be posting one more video this week before my surgery, but my surgery is on Monday, so or Monday, March 9th. So after that, you're more than welcome to follow me and you can see how I rehabilitate myself after surgery. Thanks for watching.